chat and I'll try and respond. So yeah, we're very fortunate to have Manraj here from Greener NHS, who's going to be presenting on the Net Zero Clinical Transformation Framework. Really looking forward to hearing this. Thanks, Manraj.
Awesome, thank you. I will just start to share my slides. Sort of first successes technology. So I'll just wait for that to load up. So thank you all for making time in your, I'm sure, really busy afternoon to make this session. And I hope you've had an exciting morning so far. It's a pretty jam-packed agenda, so appreciate you turning up to this. So I'm just going to go through my talk. We've got about 45 minutes, which is plenty. So I'll probably talk for about 20 to 30 minutes. I know that we're recording this, which is why we've asked you to keep your cameras off, but there'll be plenty of time afterwards to really have a conversation, get your ideas on this, and also just any questions that you've got, and we can have hopefully a rich discussion. So as Katrina said, I'm Manraj. I work for the Greener NHS programme. I'm a clinician by background, so I'm a urologist by training. But I've been with the team now for just over 2 years. And the area of work that I focus in on is net zero clinical transformation. And what I'm going to present today is a sort of action-orientated approach towards delivering low carbon, high quality, equitable care. And that's the steps to low carbon care. So what I thought I'd start with is a story, and it's a story to just situate ourselves. I'm sure we've all got things that we can relate to with regards to Martha. So Martha's an 82-year-old lady. She awakes one morning, takes her regular medication, and she starts to feel very faint and dizzy. And lo and behold, she wakes up to go to the toilet and she has a fall. She calls for an ambulance because she lives on her own. She has got family, but they're not so close anymore. They live in a sort of different county. An ambulance arrives on time and takes her to A&E in her local area. And she arrives in quite significant pain following her fall, and that's causing her quite a lot of distress. I'm sure we've all seen patients waiting in A&E in pain. And you know, that sort of starts her journey in the healthcare system that she's going to go on, to be, you know, one where she feels like she could have been managed a little bit better. So she goes into A&E, she has appropriate tests and seen by the right specialities, and she has an X-ray which shows that she's got a neck of femur fracture. I'm sure many of you can relate to that, having seen many patients in A&E and beyond with that, as well as once they come out of hospital, out into the community, depending on where you work. So she's diagnosed with this fracture, and it's deemed that she needs it repairing, so either a total hip replacement. And for various reasons, she waits almost 4 to 5 days to have a procedure. And that may be because the trust that she's at doesn't have a dedicated trauma list, and that her diabetes is pretty poorly controlled while she's waiting to have this procedure. Nevertheless, she goes to have it, and post-operatively, she's a bit slow to mobilize on the ward. She feels very low in mood, very isolated. She's often someone who's very active at home. She's got her own little veg patch that she looks after, but she hasn't been getting outside and getting that enjoyment. And so that really slows down her recovery. As a result, she's deemed not appropriate for a sort of early supported discharge. She stays in hospital for a few weeks, waiting for a community and rehab bed. And when she does get there, it takes her quite a significant amount of time to recover from this fall and this fracture. So it's about 3 months in total till she's back home, and she's really off her original baseline, which is a shame because she was a very active and fit 82-year-old. So I want you to just think about Martha, think about that story as we walk through this framework. Can we improve this? Can we make her story better? And that's sort of why we're all in healthcare, I hope, to some degree, to improve things for our patients. And I'm going to talk us through how we can start to make changes and how we are already making changes that we maybe haven't realised have win-win situations attached to them. So what is the backdrop for us making this journey better and improving the care that she gets? So no surprise, I'm going to start with the backdrop that aligns with why we're all here this week and why you've all attended, is delivering a greener NHS. So many of you will know that back in 2020, we made a commitment to delivering the world's first net zero health service. And that's on the back of embedding within this document that hopefully you're familiar with, two really ambitious but feasible targets: net zero by 2045 for all of our emissions that we can influence, and 2040 for those that are more directly controlled by us. And then fast forward to 2022, we have another first, another first health system to embed net zero into legislature, and that's through the Health and Care Act. And then look at us now, and we're really in a situation where we're starting to embed this within our structures of how we function. So as of now, every NHS trust in ICB has a net zero strategy or a green plan in place to support delivering on these commitments that we've made. And we're starting to see change across the system. So we're starting to see CQC, for example, the Care Quality Commission, which if you work within the healthcare sector is probably when you start to see walls starting being painted and new filing cabinets come in. But they are a really important part of our system. And as part of their new framework, there is a question around the well-led element of their framework on regulation to include environmental sustainability as part of that. So really the whole system is starting to move in a direction that ensures we deliver care that's good for our patients, but also for our planet now and in the future. And how we're going about achieving much of this is to look at where our carbon emissions are. And you'll be familiar with these pie charts and the image on the right, which shows you lots of bubbles of where carbon is high in the healthcare system. And I point that out because regardless of where you work within the system, so could you be out in the community, in the ambulance services as a paramedic, or in the acute setting, primary care, mental health, whatever it be, you've got some bubbles that you can start to look at and start to think about changing. And I've highlighted in red there where I think us as clinicians, and even if you're not a clinician in the audience, can have a significant impact on. And there's quite a lot of red arrows, so we've really got an opportunity to change quite a lot. So 60% of our supply chain is our supply chain causes 60% of our carbon emissions, for example. That's all the stuff that we use. But regardless of where these hotspots are or where in the system you work, meeting our commitments, I really believe, requires a system-wide and a patient pathway approach, so that we start to think of all of those bubbles within a patient lens or a clinical pathway lens. The other bit of this puzzle, the other backdrop to what we're trying to do in terms of changing Martha's story, is thinking about ways in which we can bring various bits to align, where there's already opportunities and priorities that are meeting what we need to deliver low carbon care, and how we can maximize those. And I really flag these sort of three key areas. So one is the amazing opportunity that you all have as working as AHPs and in that space. So we know that 9 in 10 NHS staff want to see us take action on climate change. You're in an incredible opportunity or position because you're the third largest clinical workforce, huge amount of AHPs across 14 professions. And I couldn't miss putting in those 14 professions graphic on there, which I love. And also based on the last slide is that you work across the whole system and the whole patient life course. So there's a real opportunity there to be at the forefront of this and to bring all of these workforce together. The other thing I highlight is the priorities we set up in our long-term plan, which is our NHS 10-year strategy to deliver high quality care, think about prevention, think about early diagnosis, and how we can think about the backdrop to delivering Green NHS and some of these other competing priorities, and see them not as competing priorities, but as the same thing. And then the one that's probably very close to all of your hearts is the AHP strategy, and it's fantastic because within there is Greener AHPs right in the sort of core and centre. So that's one of the ways of looking at the starting point of making Martha's journey better. And the reason why we're taking a net zero clinical lens to our work is because we acknowledge that clinical practice underpins healthcare's environmental impact. And on here you can see areas of the Greener NHS work that reflects where those big carbon hotspots are. And I'm zooming into that clinical transformation, pulling in things from workforce, from research and innovation, and also some sort of data and analytics. But really, it's just to highlight that within the clinical space, we can influence many of these hotspots and really underpin the impact that a patient pathway can have. So what we're aiming to do on the back of that is to really ensure that we have that clinical patient-centered lens when we're thinking about meeting our net zero commitments. That we work with the clinical community, which is yourselves and others, to transform their practice towards net zero. And as well as bringing together all of those various priorities, it's thinking about this triple bottom line, which I'm sure you're all familiar with, which is how do we ensure at the core we improve outcomes for our patients and populations, but we take into consideration the environmental, social, and financial implications of doing so. And I'd add, based on what I've said, that there is that win-win scenario where we can bring together those opportunities and priorities and get them to align together so we can meet all of these bits of this equation. So as a result, within my area of work in the Green NHS and more broadly, our purpose is really that. It's to engage the NHS staff, the clinical staff who are working in positions where they can transform their practice, to align with our values, our net zero ambitions, and to fundamentally improve health. Our vision, therefore, is that for all of those in those clinical communities, that you feel empowered to design and deliver high quality, low carbon care by default, with any guidance and support that we can offer. And we really need to be a we, because there's so much that needs doing that, you know, even just from this week, I'm sure you'll learn so much that you can share with it and support each other doing. And that really feeds into our values, which is high quality, equitable, accessible, evidence-based, patient-centered, low carbon care for all. And I really stress all because it is about equity. And there's lots of things to tick off there, but hopefully you can see by bringing multiple priorities together, we can start to achieve that. To the crux of the framework itself is what we feel it requires for now, and this will change as we start to progress in this space, is a huge amount of engagement. We need to understand the pressures, the challenges, and the priorities that we're all facing out in the clinical space. We need to figure out ways to assess the carbon impact of the care we deliver, be it across pathway, be it across services, across certain clinics. And then where we really need to be is in that space of action and that business as usual, you know, making it the default, as I said, and embedded within the systems and processes. So that's what we're aiming to achieve. And this is hopefully a framework, or don't really want to call it a framework because we've got so many frameworks that we don't really sort of action. But what it's intended to do is to be an approach, an action-orientated approach that you can take and think about when you're end the day today and think of a patient you've seen, much like Martha or someone else, and see how you could align those priorities and deliver low carbon care that's high quality and equitable. So this is the steps. And you know, the reason we've sort of working towards this is to achieve our sort of vision that we laid out back in 2020 within our Delivering a Net Zero NHS service report. So in that, we said we would have a way to look at carbon reductions across the models of care. And this is one approach to do that. And it's based on assumptions and principles for which we are gathering a significant evidence base. So what is it? So as I said, it's a principle-based approach. So it's fairly sort of common sense. It's nothing groundbreaking, I hate to tell you, but hopefully allows you to frame what you want to do in a way that works. So it's based on the rationale that every care component has an associated carbon footprint. So that could be an outpatient appointment, investigations that we would order, treatments we would deliver, through to the equipment, you know, the walking aids, all the stuff used in our imaging departments, through to the food that we serve and how we can influence that. So based on that, the carbon impact of the care we deliver will therefore increase if care needs are very high and complex, if care delivery is really inefficient and inappropriate, if care settings and treatments are resource and carbon intensive, And lastly, if the systems in which we work fail to embed net zero as core business as usual. And that's the backdrop to these steps. And at the bottom there, you can see a sort of trajectory of complexity, high use of resources, not really inefficiency, but some of the other elements that show you that the carbon emissions increase as those do. So the steps are centered around these 5 actions. So it's about moving towards low carbon care settings, low carbon care treatment, efficiency, prevention, and system change. So I'm just going to go through those step by step, and then sort of pull this all together at the end, and we can sort of show you how some of this is working. So low carbon care settings is really about reducing the carbon and resource intensity of our care settings, where we deliver care and how we engage, how our patients engage, and how our visitors interact with the settings that they may go into contact with. Low carbon care treatments is about reducing the carbon emissions from treatments and delivering high quality care, and I'll expand on that in a minute. The efficiency is really about delivering the right care at the right place, the right time. And hopefully you'll find in that objective, which is to reduce inefficient and inappropriate care delivery, you'll find that you're already starting to do that. There's lots of quality improvement, there's lots of research, there's lots of action going on to improve this element of how we deliver care and improve efficiency. And then prevention, which is really about keeping people healthy, thinking about being upstream. How can we reduce the needs of our patients and our populations and reduce the burden of disease? And then fundamentally, that system change. What do we need to enable all of these other steps to come into place is really engaged and supportive clinical leadership, systems and workforce. And that objective there is to ensure that net zero is embedded as business as usual. And without this sort of outer donut to this pizza, very unhealthy, we won't start to see the changes that we want. So I'm going to break these steps down, and this is what is part of the framework to give you a bit of a steer of how we can move towards, low carbon care settings, treatment, efficiency, prevention, system change. And these are just pointers, and they're not fully, a full sort of list of things that should be done. They're sort of steers of where to start. So if we look at low carbon care settings, the aim is to really take a clinical lens on this. So how can we, as the clinical community, think about efficient use of energy in clinical spaces? Can we come up with new models? Can we think about behavior change mechanisms to switch off, let's say, machinery at the end of the day? How can we think about how our visitors and ourselves interact with the settings with regards to how we get there? So reducing travel and transport emissions, and then reducing the waste from our food and promoting really healthier, lower carbon diets. And there's a real sort of need there for wider MDT working. How can we use healthcare professionals, so nurses, dietitians, to support that bit? When we think about treatment, it's really about thinking through where are those areas of identifying and changing the areas where we can have low carbon treatment options. We already know some big hitters, so inhalers and anesthetic gases, but we need to really look more broadly and analyze the care that we deliver. And then really one way to do that is to consider the social value and the carbon in our procurement decisions and be part of that procurement decision process and influence it. And then as the users of all of that stuff, 80,000 strong suppliers, we need to think about reducing the demand for that. And that will really shift suppliers to respond to the need for circularity. Efficiency, again, as I said, is what we know. Are we ensuring that we are aligning with best practice? And if we are, and we've got mechanisms to do so, can we put a net zero lens to clinical guidelines? Can we start to change them in a way that support us delivering care in low carbon care settings and treatments? Can we deliver efficient and streamlined care? And again, these are things that you're probably already doing, which will reduce those inefficiencies and duplications of tests or whatever it may be. And fundamentally, can we bring patients with us? Can we have patient-centered care that allows for shared decision-making? So that's, making every contact count, having those conversations with our patients. And that will allow us to also optimize care location, be it closer to home if appropriate, and this digital transition, but ensuring that any digital solutions have a low carbon narrative attached to them, because everything we do, as I said, has carbon attached to it. We need to ensure we're doing it responsibly. Prevention, can we think about disease prevention and health optimization? And I think this is a really great opportunity for AHPs, because you interact with patients, as I said, across the life course. And can we get in there upstream? And can we do so in a way where we're plugging actions that are good for climate mitigation, such as a more active lifestyle, active travel, healthier diets, reducing air pollution? And things that you're probably already doing is ensuring early diagnosis and treatment. And that comes with empowering patients to self-manage. So they're active members of the care that they deliver and their health and their own health. And then system change, clinical leadership, which the AHPs are a fantastic example of, especially having this whole week dedicated to this. Education and training for the workforce. And I think you're hearing from Jessie, one of our previous fellows, on how that's really being embedded through the life course of training. Embedding it within strategies, structures, policies, and these don't have to be at a high, NHS England level. They can be within your own departments, within their own SOPs, standing operating procedures you have. Think about how you're going to monitor and evaluate things. Whichever role you have, find resources and opportunities where those alignments are already there and you can add on sustainability to them, such as SUSQI, that's sustainable quality improvement. And then really start to support the research and innovation that we're going to need to take this forward. And then if you work out in the system, start to leverage the role of the integrated care system. So that's the steps. And I think what I'd like to end on really is to retell Martha's story through that lens. So this is the steps in action. And this is what her journey could look like now, and it does in some trusts and regions around the country, but also in the future. And hopefully you can start to use some of this in your workplace. So Martha, let's visit her again. So she's 82, she wakes up in the morning, feels dizzy, she has a fall, she calls for an ambulance. But not just any ambulance, a low carbon emitting net zero ambulance in which the paramedics have really taken a proactive look at the use of nitrous oxide and put in measures to have very definitive pain relief on board, so that when she does arrive to her local A&E, which has a green plan in place, she's got well-controlled analgesia. They've also aligned to the Green ED framework, which has been launched by the Royal College of Emergency Medicine to really tackle their carbon emissions from their emergency department. And let's say they've got bronze accreditation for doing that, which means she doesn't get an unnecessary cannula if she doesn't need it. And there's lots of other measures that they've put into place. She enters a streamlined pathway, falls pathway that's in place within the hospital, and she has her imaging done in a timely manner in a radiology department, much like this one in Milton Keynes, that has solar panels on its roof powering its CT scanner and X-ray department. And that's thinking about those settings. What can we do for our settings? As I said, no spoiler there, or spoiler. She's got a neck of femur fracture. She has an operation on a dedicated trauma list in an operating theatre where the ODP has taken the lead to implement the Green Surgery Checklist, which looks at sustainable procurement, as well as rationalising trays. And they've decommissioned the use of Desfrane, and it's just sort of not in use there. And it's been swapped for safer alternatives. In the run-up to her operation, she's had shared decision-making with her anaesthetist, and they've had a discussion around a GA or a spinal. And all the staff so far in her journey have had training on sustainability at an introductory level available on our Future NHS page. She's seen the next day by a physio on the ward. She's mobilised post-operatively on day 1. She has a MDT review, OTs, pharmacists, dietitians. The pharmacist does a review, and it turns out that she had new antihypertensive medication that had been put into place some weeks before her fall, and that was causing her postural hypertension, which then gets stopped. She has a medicine review, reduces polypharmacy and over-prescribing. Importantly, she gets fall prevention plan in place, and that's to negate, yes, this low carbon pathway from happening again. She's safely discharged within 7 days, roughly. She has and meets the criteria for early supported discharge, virtual follow-up, community rehab, and district nurses reviewing her wound. And this, I think, is the reality, maybe not in all totality yet, but we are getting there when you piece together all of the system change that's happening. So I'm going to end. I'm aware I've been going on for a little bit, and I want to have some time for us to engage on what can I do, what can we do, what can you do, which is often the sort of question that I'm always left when I listen to somebody else and think, oh, but what could I do? And I think what I'd leave you with is to really say that use your unique role as AHPs, as I said at the start. Start having conversations, join networks, take action, lead, you really can, and share ideas and collaborate, and do so using all of these circles. So circularity, I guess, is the message to also take home, is see if you can implement the STEPS framework. See if you can work on really working on that sphere of control that you may have, or the sphere of influence, and then everything else that comes around it. And then lastly, the sort of Venn diagram on the side is about finding what brings you joy, what you're good at, what aligns with the work that you do at the moment, what skills you have or resources, and what work needs doing, which is a huge amount. And that really then will guide you on climate action that's sustainable and something that you're passionate about. So I'll leave you with those sort of circles and hopefully steer on what is achievable, and I'll pause there to just take any questions. I won't go through all of these other bits, it's a bit too much, but thank you. I'll stop sharing so I can hopefully see everybody.
Thank you so much, Manraj.